Hello, I'm Dr. Collins, and in this video we will go through a single best answer style question to help you improve your exam technique and build your confidence. We will cover some tips on how to best approach SBA style multiple choice questions, which are the bread and butter type of questions of most medical exams, and we will focus on how to narrow down answers logically and how to make good educated guesses if you are unsure of the answer. But before we start, I'd like to emphasize something that we sometimes forget. If you aren't getting the right answer of this question, or any question for that matter, I'd like you to pause and remember that getting an exam question wrong is not reflective of your worth and intelligence. Please be kind to yourself and keep going. It's the perseverance and learning that matter. That said, let's have a look at this question. An 18-year-old female, originally from Cyprus, presents to her general practitioner complaining of tiredness and reduced exercise tolerance. An initial blood screen reveals the following: hemoglobin of 100, MCV of 63, and ferritin of 72. A follow-up blood film demonstrates target cells. What is the most likely diagnosis? Now, before we look at the question, let's break down a few things. Nowadays, most exams are computer-based, but if you're sitting a paper-based exam, a useful technique is to highlight the key clues in the question stem as you read the question. What we're doing here is training ourselves to identify the giveaway points of the exam question, the information that actually drives the diagnosis. So let's go through this step by step. The patient is an 18-year-old woman from Cyprus, which is a Mediterranean country and clinically relevant because certain inherited blood disorders are more common in this population. Her hemoglobin is low, so she is anemic. Her MCV is also low, which tells us this is a microcytic anemia. Remember, there are broadly three types of anemia. Microcytic is if the MCV, in other words, the size of the red blood cells, are small, less than 80 femtoliters. Normocytic if the MCV is between 80 to 100, which is normal. And finally, macrocytic is if the MCV is over 100 femtoliters. At this point, we already categorized the problem. She has microcytic anemia. Now we look at the iron status. Her ferritin is normal, so there is no evidence of iron deficiency anemia. And finally, the blood film shows something very specific: target cells. So putting this together, we now have a microcytic anemia with normal iron stores and a blood film showing target cells, which should immediately narrow our differential significantly before we even touch the options. If an SBA question is well written, you should never need to look at the options. You should be able to tell the answer without needing options. And you should try this with every question. And if you know that thalassemia is a very common inherited genetic disorder in Mediterranean regions such as Cyprus, and that it typically presents with microcytic anemia with target cells on blood film, you would not need to look at options. Therefore, this is an excellent question. However, let's say that we don't know these facts, so we can't immediately pinpoint the answer to thalassemia. And remember, it is okay to not know. This is exactly why we are studying, and there will always be more things to learn. What we will therefore do next is to look at the answers and use the elimination method to come up with the best educated choice. The choices are sideroblastic anemia, B12 deficiency, beta thalassemia trait, iron deficiency anemia, and hypothyroidism. So first thing first, let's get rid of the iron deficiency anemia because her iron reserves are full. Even though the iron deficiency anemia is the most common cause of microcytic anemia, this question gives us the parameters for the iron levels, so you can just eliminate this option right away. So we are left with these other four options. B12 and thyroid disorders causes macrocytic anemia. Given that our MCV size is very small, you can definitely cross these off our list as well. Now we're left with thalassemia trait and sideroblastic anemia, both of which does cause microcytic anemia. If you're struggling to remember the causes of microcytic anemia, check out one of our medical mnemonic short videos that will give you a quick, memorable way to remember these within a minute. minutes. The two important clues that point to an answer of beta thalassemia trait here are A. The target cells on the blood film. You can find these type of red blood cells, which are also referred to as the leukocytes, both in thalassemia and sideroblastic anemia. However, they are considered to be one of the classic primary morphological features of thalassemia on the peripheral blood smear and a lot less common in sideroblastic anemia. And the second important clue is the question is asking for the most likely diagnosis. Thalassemia is among the most common single gene inherited disorder worldwide, with millions of carriers globally. In contrast, sideroblastic anemia is a distinctively rare condition. So with that said, we're left with thalassemia trait as our final answer. Remember, both thalassemia major and carrier trait form of the disease can cause anemia, but if somebody had thalassemia major, you would have known that a lot earlier than 18 years of age because they would be requiring regular blood transfusions. Thanks for watching. If you like this video, please like and subscribe to fuel the passion to create more videos. And don't forget that your value is not defined by whether you get a question right or wrong. Exams measure knowledge on a particular day. So let's keep building your medical knowledge together. Good luck!